Okay, so just starting out, I am introducing myself as Ashlyn, the student nurse. I have verified name and date of birth, and I will be assessing the respiratory rate, rhythm, and depth. I will auscultate breath sounds and look at the pulse oximetry. I have also assessed for the signs that may look like cyanosis, and I have determined that there is need for suctioning. I'm performing hand hygiene. And I did turn on the wall suction after I've already positioned the patient in a semi-Fowler's position and the linen saver pad. However, I cannot position him in a semi-Fowler's position due to the pillow and the table. It is 100 to 150 for adults, 100 to 120 for children, and 50 to 95 for infants. Hand hygiene again. The basin is going to be my package that I will open, like a sterile field where I would be able to fill my sterile saline in. And these are my sterile gloves that I'm opening. I have also already put on my PPE. Just making sure to still hold from the inside of the glove there and situate afterwards. Reaching under the cuff, not to contaminate the sterile gloves. Orient myself and slide my fingers in. Careful not to let go of the cuff. And pull up. Now you can resituate your fingers. Just turning my package around so that it's straight, not hanging off the table. That is my sterile saline I have open and I'm pouring into the container. I would lip it, of course. Not turning my back on the sterile field. I'm checking the suction. Keeping that hand non-sterile now. Reaching into my sterile field container that I opened, grabbing my suctioning tube out of the package. My suction catheter. Careful not to touch the actual suctioning catheter with my non-sterile hand, and just measuring, and it will go no greater than 6 inches. Here I'm just trying to situate it because it doesn't actually slide into the suction tube. I'm going to check suction and make sure that the catheter is suctioning correctly. Also now lubricating. Also, I would have been sure to hyperoxygenate my patient. And you never suction on the way in. And you provide 30 seconds before each suctioning, and then for no longer than 5 minutes. Dip it in the sterile saline. You suction and twist on the way out. Going back again, being sure to provide the 30-second break. And I will repeat as needed, no longer than 5 minutes again. Suction on the way out, being sure to suction everything out of the catheter, coiling it in my hand. after I've sterilized it again. And here the tube was falling, so I did not discard the suction catheter in that glove like I was supposed to, so I was trying to fix the tube from falling. Now I discard both my gloves in the biohazard container. And I was just showing there that I did have another set of sterile gloves for demonstration purposes that I would place on. Again, grabbing the inside of the cuff not to contaminate the outside of the sterile glove. After orienting myself. Sterile gloves are placed. Now I'm going to just sterilize the end of the suction tube, hanging it back up, replacing the oxygen source, turning off the suction, and I will provide mouth care to my patient, and I did assess the secretions for color and consistency, and I will see how the patient tolerated the procedure, and I will get some new vital signs at this moment. And since my patient is unconscious, I would have asked him about pain tolerance as well. Here I'm just clearing up my sterile field and performing hand hygiene.